Hey, what's up, everybody? Jim Adams, owner of Catalyst Personal Training and Functional Nutrition, here to talk to you about joint pain. Could the cause be part of the cure? Hey, what's up, everybody? Jim Adams, owner of Catalyst Personal Training and Functional Nutrition, here to talk to you about joint pain. Could the cause be part of the cure? We've all had joint pain, whether it's knee, back, shoulder, hip, you name it. We've all had some type of joint pain, be it from strains, sprains, inactivity, overactivity, lack of activity, and then all of a sudden getting active again. You name it. And in this case, the cause can be part of the cure if tensegrity is involved in that. Now, it's a fancy word. They use it in architecture. Matter of fact, you can see it a lot in architecture. If you go to over to Alton, look at the expansion bridge over there. That's tensegrity in action with those cables, the way it's held up. But your body works the same way in the joints. You have the joint that where the bones move, and then you have the muscles surrounding that joint. Well, what happens, let's take the hip joint, for example. And I was fortunate enough to run into a phenomenal physical therapist by the name of Joanne Moxa. She was born in Montreal, did her training in New York, and then moved here to open up a clinic. And then that clinic shut down. So she moved in with us at Catalyst. We were fortunate to have her under our roof for a long time. And we work with her very closely, still work with her very closely now that she has her own practice in University City. So if you have a physical therapist need, definitely go see her. I recommend it. But she was the one that woke me up to tensegrity, because I always understood about the soft tissue and the fascia and how that creates tension in the joint and the muscles and how that can affect your movement. But I didn't expand that to think about how that affects joints until I met Joanne. So let's just take your hip joint, for example. For those of you guys who are listening instead of watching, I'm making a C with my left hand, making a fist with my right hand, and putting into the C. That's kind of like your hip joint, oversimplified hip joint, right? As long as there's equal space on either side, all around the joint, it moves full range of motion, no problem, no pain, no issues. But what happens most commonly in the hip joint is that you don't work out beyond high school or college regularly. You don't do any strength training. And then you sit on your butt all day in your chair, boardrooms, in your car, at home, on the couch, on planes, you name it. And then when that happens, your glutes and your hamstrings don't fire and don't turn on the way they're supposed to and when they're supposed to. So what happens is you become very quad dominant. And we see this a lot when we do movement assessments when people coming in. So when you're quad dominant, going back to my visual aid, the C and the fist, when you're quad dominant, your glutes and your hamstrings aren't pulling to keep that joint centered. Your quads are pulling much harder and with much more force. And so what happens is this gap closes on the front end of the joint. And then that causes friction, which can cause all kinds of problems and limit your range of motion in that joint. So that's how tensegrity is supposed to work in a joint. So in most people's cases, what we would do in that, if they were diagnosed, if Joanne sent a client over to us, then she would let us know that, and then we would devise a training program to turn on their glutes and their hamstrings and make them stronger, less quad dominant, so that we can center that joint. Now, there still may be some insult to the joint, so you have to wait for that to calm down and see how severe that insult is to the joint, whether it's permanent or your body can recover from it. So that's two issues going on. You have to fix the tensegrity of the joint, and then you have to kind of see where that insult lies, whether it's something that is going to permanently change that joint or if it's something that you can continue to move forward with. So that's how tensegrity can be part of the problem, but also part of the fix. And it's also to say that you don't necessarily always have to go under the knife, right? Work with a doctor, work with a physical therapist, work with a trainer who is willing to work with other professionals to improve the quality of your life without some kind of evasive surgery where you have to be sidelined for weeks or months. And the other thing that I will tell you about taking this path, the path of working with your doctor, working with your PT, working with a qualified trainer, is that it takes time. Because let me tell you something, this right here, that lack of tensegrity in your joint didn't happen overnight. That's years of sitting, years of not moving, years of not working out, years of doing whatever it took to get you to that point. So it's not like you're going to be able to go into the doctor or your PT or the trainer and they're going to be able to, boom, snap their fingers and fix you. It's going to be a process. Because I know for me, since I've been home going on 8 weeks, I used to see Joanne for my hip pain. Well, obviously I couldn't see Joanne or anyone else. So I had to devise my own treatment plan at home to fix my hip pain. Because let me tell you something, it was intense. I was this far from calling the doctor and say, hey, just, I need a hip replacement. It hurt me that bad constantly. So what I did is I took one of these bad boys, this percussion gun, and you've seen them on the internet. And no, they're not a gimmick. If you buy the expensive ones, they're actually really legit and they help tremendously. And I would take this to my quads and my hip flexors to loosen them up, to take some of that tension out. And that's what foam rolling, the percussion guns, massage therapy, all those soft tissue interventions do, is that because when your muscles contract, they slide over one another. And then when they lengthen, they do this. Same thing with your muscles. They slide over one another. But every once in a while, you get some kind of adhesion in there where it sticks or they stick. And all of you experience this when you've slept on your neck or some other joint wrong and you get up and then all of a sudden you can't move. It's because you got stuck. So there's no amount of stretching, warming up, working out that's going to get that kink out of there. You got to go in there and you got to break that stuff up so you can get that muscle and that joint moving back to its full range of motion. And that's where foam rolling, massage therapy, and these percussion guns come in. So that's why I do this first. And then after that, I do some surgical stretches, some very specific stretches for my quads and hip flexors to lengthen that muscle, to give them a little bit more play in the joint, give the joint a little bit more slack on that side. And then I stop training my quads, because if you want a muscle to get tighter, keep training it in that shortened range of motion. So I had to stop training my quads, giving it that stimulus to contract. And then I continue to train my hamstrings and my glutes. And that was along with some ice and some Tylenol. And I choose Tylenol versus ibuprofen for those out there who live on vitamin I. Couple of questions you have to take into, a couple of things you have to take into consideration. One is that ibuprofen is an anti-inflammatory. And when you think about it, when your body gets injured, whether it's a strain, a bruise, everyone's rolled their ankle, then what happens to your ankle? It blows up, right? And what that is that's your body flooding that area with blood. And blood is your body's oil. It brings nutrients, other materials to help repair and fix that. It assists your immune system in clearing anything out. And then it also takes out the trash. So blood is very vital to the healing process. So when you take ibuprofen and you deprive that area, in this case, my hip joint, of blood, then I slow down the healing process. So that's why I go with Tylenol. It takes care of the pain, but it allows blood to get into that joint so it can start to heal. So I can see what level of insult I have to that joint and if I'm going to be able to continue tolerating that. So that's why I recommend Tylenol over ibuprofen. Now you have to be careful, because the other thing you have to consider is, why do you need to take so much ibuprofen? Why is your body in pain? Pain is a messenger. Your body is sending you a message that something is wrong. So you have to address that. And I don't want to get on that soapbox. I just want to make those 2 points. One, you need blood flow for healing. And two, it's not normal to be in pain all of the time, regardless of your activities. So think about those 2 things. And also, the next time you have some joint pain, think about tensegrity and if that can play a part in it. And if you think that may be the case, then go to your doctor and ask them. Go to your physical therapist. Go to a qualified personal trainer and see. So, and we'd be happy to help you out at Catalyst, but I know there's other physical personal trainers out there that can help you. But I also know there's a lot that can't, that will hurt you. Because if you throw yourself on the squat rack and you got hip pain, so if you walk in presenting with hip pain and I put you on the squat rack, the one exercises that puts the most stress on your hip, what do you think is going to happen? You're going to have more intense hip pain, right? And especially if your glutes and your hamstrings aren't activated. So, so check these people out and be sure to take care of yourself, and make sure that you're checking out the people that you're trusting to take care of you. So until next time, I hope you guys are well, and I hope you got something out of this information. If you like this information or any of the other information that we give out on this show, be sure to subscribe and let us know how we're doing. If you like what you hear, leave a 5-star review. Those are always the best. But if it's a 1-star, we want to hear that too. And write us a little paragraph. We may give you a shout out on the show, good or bad. Because we're always looking to get better, just like you guys. So until next time, be well, and talk to you later.